Dr. Bharat Pankania is a senior clinical lecturer at Exeter University. Doctor, always good to speak to you on the News Hour. So the United States left the WHO during Trump's first term, but it takes about a year for them to fully pull out of the group. But how big an impact is it going to have in the immediate future?
I think it's very unfortunate because the United States is an active member of WHO. In fact, the United States was a founding member of the World Health Organization. And to draw analogies here, there is a similar parallels with the United States at the top table of the World Health Organization is the rule maker. Similarly, the United Kingdom was a rule maker when it was part of the European Union. Now the UK is a rule taker. And similarly, the United States is unnecessarily isolating itself from global illnesses and diseases, which will affect the world and in turn will also affect the United States population.
Dr. Donald Trump has been critical of the WHO, particularly when it came to the COVID response and the investigation into the origins of COVID. He's not the only one who says that the organization does need some sort of reform. Would you agree with that?
Of course I do, and in a statement released by the World Health Organization, they address this very aspect, which is they have undertaken reforms, regulation and review of how their, what you would call governance works. And furthermore, the United States as member of the WHO was taking part in the reforms and governance of the World Health Organization, and now it's not sitting there at the top table to see it through.
Do you think that it's unfair in some ways that some countries contribute more to the WHO than others, or should it be based on how much a country can afford to pay? The United States, of course, is a richer country than many others, but at this point, with them removing themselves from the WHO, would another wealthier country need to step in?
We need also wealthier donors and other member states which will have to contribute more, but the United States should stop looking at it in the short term because the United States can afford it. And furthermore, whenever there are viral hemorrhagic outbreaks, a pandemic or unknown infections sweeping the globe, an unhappy globe equals an unhappy world. And what happens in Africa will also affect the United States. So it is short-termism to abdicate your responsibility as the richest, most powerful nation on planet Earth. In fact, the United States should be leading rather than saying, I wish to take my football away, I don't want to play with you.
Dr. Bharat Pankania, thank you so much for your analysis. Appreciate it.
Thank you.